Topical fluorides. As we have seen, there are two kinds of topical fluorides: professionally applied topical fluorides and self-applied topical fluorides. As we have discussed earlier, the professionally applied topical fluorides. Now we are moving on to the self-applied topical fluorides. These self-applied topical fluorides have depends upon the patient behavior, and it has a major role in day-to-day life. So these self-applied topical fluorides are nothing but dentifrices, mouth rinses and fluoride gels. So these dentifrices are used as a personal behavior on the daily basis. So this has a major content or intent in prevention of the dental caries. These dentifrices provide a low amount of fluoride ion concentration, or it acts as an anti-caries agent, and it helps in cleaning the tooth surface on day-to-day basis. So a person need to brush twice a day with the help of a dentifrice, and these are the self-applied topical fluorides. Self-applied topical fluorides. So coming to the dentifrice. Dentifrice is nothing but it's a mixture of abrasive or polishing agents, detergents, binders and flavoring agents. These all together mix up and form a dentifrice. It's a mixture, and there are some substances necessary to facilitate their preparation. So these abrasives helps in cleaning the tooth surface. These detergent and binders all together mix up and form a therapeutic paste or a dentifrice. So exact formulation or exact formula of an dentifrice depends upon the manufacturers. So coming to the dentifrice, way back, clinical trials of fluoride dentifrices was done first by BB in the year 1942. The first clinical trial on dentifrice was done by BB in the year 1952. So the first product used for the dentifrice was sodium fluoride. Sodium fluoride, with the help of a dicalcium phosphate as an abrasive, this was developed for the cleaning of the tooth surface or as a dentifrice therapeutic. But this what happens because of the low caries prevention, low caries activity, and due to the incompatible of sodium fluoride to the binding agents, some of the other binding agents in the dentifrice, it was not that successful, or it was not that able to prevent the caries, and it has got its own disadvantages. So later on in the year 1954, Muller et al. Has developed stannous fluoride with the help of a calcium pyrophosphate as an abrasive system. He has developed another dentifrice. So in 1965, Torrell and Erickson used sodium monofluorophosphate and dicalcium phosphate as an abrasive system, and they have developed the other dentifrice. So here in 1967, Koch developed sodium fluoride plus acrylic as an abrasive system in another kind of a dentifrice. So again in the year 1981, Zachary, sodium fluoride and silicon dioxide was used as an abrasive system. So mainly the different types of clinical trials were conducted on the dentifrice, and they developed a dentifrice such a way that which helps in providing a maximum benefit of prevention of dental caries and cleaning up of the tooth surface, and prevention or development of the other materials or sticking up of the other materials or fermented materials to the tooth surfaces. So coming to the functions of dentifrice, mainly the dentifrice has two functions. One is cosmetic and the other is therapeutic. The therapeutic functions of a dentifrice are physiomechanical functions and chemical functions. So the main functions of the dentifrice is physiomechanical function and the chemical function. The physiomechanical function is it removes the fermentable materials. Whatever the food we have, there are some fermentable and non-fermentable materials. So the physico-mechanical function is it removes the fermentable materials from the tooth surfaces. The other is it disturbs the delicate balance of environmental conditions necessary for acid formation. So whenever there is development, or whenever there is a deposition or deposition of the tooth surfaces or substrate on the tooth surface, it disturbs the balance of environmental conditions. It does not